Hello, everybody, and welcome to another Polestar Pilates Hour. As you're sort of coming on to the scene here, we want you to take the opportunity to just do a little shout out where you're joining us from in the chat. It's good to be back. I've been on the road quite a bit the last 2 months. I was in Turkey for a Line the World tour that was amazing. I hope you saw some of the Instagram posts from that. And then also recently went to India for the first time and presented at a Bounce Body Pilates on tour that also was phenomenal. And even though it was a quick trip, had lots of good food, met lots of good people, and I even learned how to dance Bollywood in the party at night. So, Karl, you would have been proud of me dancing Bollywood. Sure.
I'm sure you did just fine.
So it's my honor and privilege to introduce Dr. Karl Bourne. And Karl is a physical therapist that works at the flagship facility down in Miami as a physical therapist and as a Pilates teacher. And Karl, I've known since he was a student at University of St. Augustine and have watched him mature and practice, and even did a couple years with Cynthia McGee, one of our senior educators from the past, and worked side by side with her, filled with lots of experience and most importantly, that tenacity that is going to take you a long ways, Karl. So I'm really excited for your career and where you're going. And in particular, Karl is very interested and has been developing his practice around golf and rotational sports. So I thought it'd be good, Karl, to have you on today and for us to sort of have a dialogue. If we need to show some images, I got plenty of images for us. But that way we can and talk about it. And I'll share another thought too is I feel that, Karl's questions, Karl's seeing patients and clients, and as he has questions, he brings them to me and we work them out together, and sort of part of our, we're building a pathokinesiology education and potentially residency. And so Karl's helping me with that, being my first resident. And as we have these discussions, I was thinking like, wow, this would be really good for everybody, because I'm sure everybody's having these same kind of questions, and also has the same skill set as Karl and I have to be able to sort of problem solve them. So I thought this would be a fun format. Karl, take a moment and just share with everybody sort of what your interests are, where it's taking you, some things that have led you down the road of sort of being interested in golf and rotational sports like tennis and pickleball and paddleball, those kind of things. And now padel, I think that's how you say it.
Yeah,
It's
I
like
think so.
blowing up all over the place. And I'd never heard of it. And then somebody looked at me like I was stupid because I didn't know what padel was. And I was like, how do you spell it? I don't even know how you spell it, but they pronounce it down in Miami, padel. And then I saw it in Spain. It was all over the place in Madrid. And I was thinking, okay, this is, like pickleball in a racquetball court where you play off the
Yeah.
wall and stuff. So even more intense than pickleball because you're playing off the walls. So it means you're more rotation. Okay. So tell us a little bit about yourself and your interest in rotation sports.
Yeah, most definitely. So first off, let me just show you my appreciation, and just express how grateful I am for you bringing me on. I know how successful this Pilates Hour platform has been for you, and just truly humbled and grateful for the opportunity to kind of share some of the knowledge and stuff that I've gained from my experience as well. Just to kind of give everyone a background on myself. So, as Brent said, I am Dr. Karl Bourne Jr. I had my doctorate of physical therapy from the University of St. Augustine for Health Sciences, which is here in Miami. It's in Coral Gables. That is where me and Brent met and where we essentially developed this strong bond and friendship that has blossomed over the years. And for myself, coming out of school, I started in the workers' comp world, and that was a very interesting area to be in because you're dealing with a variety of individuals, and I like to kind of think of two spectrums as far as workers' comp, which is you have the people that are getting better, but they're not going to let you see that they're getting better because they don't want to go back to work. And then you have the people that are not get or that are getting better and or are not getting better, and they're going to tell you that they are because they do want to get back to work because they may be the breadwinner in the family, so to speak. So that was a pretty interesting spurt that I had for a while, and I transitioned from that because I just kept banging my head up against the wall like, I don't really know if my interventions are working or not because someone's telling me that it's working, others are telling me they're not, and I'm like, we just got here, so I don't know if you're telling me the truth or you just want to get back to work. So I kind of transitioned out of that. That model was also what we call in the physical therapy world like a mill. So I like to think of it like a drive-through, and it's just patient after patient after patient after patient, and you're kind of juggling patients all day long. And I just didn't think that was an efficient way to really treat. I don't think that that model in the physical therapy realm in general is a successful or efficient model when it comes to patient outcomes.
Yeah.
It may be as far as revenue, and we know that that's what it's designed to be effective for, but I wasn't concerned about the dollars. I was more so concerned about being able to get people results. Once I transitioned from there, I went to an outpatient orthopedic clinic here in Coral Gables that I was with for several years. As Brent said, I was with Cynthia McGee, working side by side with her. Cynthia was great. She gave me a lot of great knowledge as far as the Pilates and stuff because of her background and her being an educator with Polestar. So I have a lot of reverence and respect for her for kind of helping give me an additional set of knowledge and tools to use in my tool belt. And so some of the things that I feel very comfortable with, are your typical musculoskeletal orthopedic conditions, simple, complex. I love them all because they force me to have to critically think. And I love that because in a world where in school you're given so much foundational but also fluff material, I think there's a lot of things that kind of get lost in translation that you don't necessarily get until you get out of school and you actually kind of grind to develop your critical thinking, your knowledge, your skill set, and things like that. And so I love working with orthopedic cases. And me and Brent, we talk all the time about different cases that I'm seeing in the clinic. He tells me about cases that he's seen and his experience. And I love that because I know I don't know it all, and I know it doesn't matter how many years I have under my belt, I will never know it all. So I'll always depend on, a mentor, other people that have been there to kind of give me some expertise and share knowledge. So the golf thing that came just, I started playing golf and I was like, this is pretty cool. And once I just kind of started learning more about golf and the different things that golf was composed of and really getting an appreciation for the sport as well as the connection between golf and the Pilates world, which kudos to Brent. Brent is the one that got me into the Pilates world. I had zero interest or, zero desire to transition into the world of Pilates. But now that I'm in it and I'm immersed in it, I see as a clinician how it's made me so much better as far as noticing things as far as movement patterns and things like that and being able to be efficient in treating patients. So in a nutshell, that is who I am and just some of the experience and everything that I've had.
Now, I've noticed over the last number of years together, you love to, the word immersion is a good representation of your hunger to learn things. And when the book first came out, Principles of Movement, Karl absorbed that pretty quickly and would actually have these great questions at night while we were driving home from work in the different states in the country. But maybe share a little bit about things that you've noticed with your passion for golf and how you see the principles overlaying what you're working on with golfers. And again, when we say golfers, we're talking everything from high school teams to recreational golfers to potentially professional golfers. But what are some things that you observed in your study of the principles of movement and the practice of working with golfers?
Yeah, so I love that question because there is a lot of overlap. In Polestar, we use the PAT assessment, right? And we use that assessment as kind of a way to help us understanding just different relationships within the body and some things that may need work, asymmetries and things that can kind of direct and drive how we prescribe the exercises that we give to our patients and our clientele. A lot of things that I've noticed that kind of overlap between the golf world and the Pilates world is in a lot of the learning and the continuing education that I've done. Two things that I can tell you off rip that coincide is with Polestar, we have the trunk rotation test that we do in seating in a seated position. We also do that same thing in the golf world and in the world of TPI, which is where I went through and did like my additional certification through for golf. And so you see the overlap there between the importance of what? Rotation, right? Because these are rotational athletes that their rotation is going to dictate a lot of the things that they need as far as golfing, right? If the rotation is not there in certain levels of the spine, that is going to have an impact on how they're able to get an additional 20, 30 yards possibly on their drive, right? Which is something that we can say with confidence, like if you work with us, if you work with me, I can guarantee gonna get you an additional 20, 30 yards on your drive.
I've never
Why?
lost a bet. I've never lost a bet on that one.
Why? Because we understand the importance of thoracic rotation and we understand the importance of how that translates over to golf. And so in Pilates, a lot of different things that we use involve being able to work on breath, right? Work on mobility, work on control, work on movement, integrate, all these things that are going to be also important for a golfer. And so when I sit there and I look at someone doing a swing and they're starting from address, which is just the starting position that they get into before they go into their backswing. Once they go into their backswing, I'm able to kind of see how are they movement? Like how is the movement looking? Is there adequate rotation of the hips? Is there adequate translation of the trunk? Adequate thoracic rotation? I'm looking from top to bottom. And so that alone, in correlation with the Pilates knowledge and stuff that I've learned, that is movement integration right there. Because I'm looking at the whole organism, the whole human being from top to bottom to see what things am I noticing? But I also ask them for feedback. What do you feel? Well, I feel like my left hip is kind of tight here. Okay, let's take a look at it. Maybe we have some internal rotation deficits, some external rotation deficits, some things that we can work on to be able to make them more efficient on that backswing and the acceleration phase of that golf swing. And a lot of the time I look for like a peak velocity going from pelvis, thorax, arms, and then the club. And
Mhm.
that transitions the same from the top of the backswing through the acceleration phase to the deceleration phase as well. Because I'm looking for them to decelerate at a rate where it's their pelvis, their thorax, their trunk, or their arms, and then the club. which tells me that they're getting an efficient golf swing going on. So I see a lot of correlation between the mobility, the movement integration, and the control, because those are a lot of areas of overlap where in my golf training, they talked a lot about being able to look at upper and lower body disassociation, which is another thing that we work on through Pilates and here at Polestar, as well as core control, which if you just drop the word core, control is one of the principles that we have here at Polestar as well. So there's a lot of good overlap there that shows you kind of how golf and Pilates can work together to make someone better from a performance standpoint or from a rehabilitation
Yeah.
standpoint as well.
Awesome. Hey, Karl, is there any, I haven't looked myself, and I don't know if it
Yeah.
exists or not, but research out there right now, just sort of looking at um, the incidence of injury with golfers. What are the areas of the body that are most likely to be complained about by golfers? And maybe it's different for beginners versus more advanced golfers, but do you have anything that sort of talks about that or that can give
Yeah.
people the light?
So
Because I'll make it up if you don't, and I'd rather have the stats in front of me.
no worries. No need to make it up. No need to make it up. So I will tell you one of the studies that comes to the top of my head. It was done by I want to say it was the Norwegian School of Sports Sciences, and it was just based around golf related injuries. And one thing that they found is that low back injuries accounted for up to 34% of all golf injuries. And then after that, it was followed by elbow and followed by shoulder. So there's a lot of research out there, not just from them, but there's other articles also that kind of talk about that. And there's one specifically that's just golf injuries and rehabilitation that also talks about some of the common injuries that you'll find in golf. And one of the things, Brent, that I thought was really interesting, that I don't think a lot of people are aware of is we have this idea of when it comes to the elbow, it must be golfer's elbow, right? It has to be. Medial epicondylitis, that's it. That's the culprit. Like point, like right here is where it's hurting, right? And what some research actually found is that there is a significant amount. Let's say, for example, like I am, and I'm a right-handed dominant golfer. So for me, when I'm going into a backswing, coming back down, my left arm, my left shoulder, this is my lead arm. And what they noticed was that there also is a pretty high incidence of not just medial epicondylitis or golfer's elbow, but also, yeah, also a lot of tennis elbow
On
on
the
that lead
opposite.
arm. Yes.
Interesting. Yeah.
Exactly. And so I thought that was pretty interesting because, for someone who may be a novice when it comes to treating golfers, and a golfer comes to you and they're like, yeah, like, my left elbow was bothering me. And you're sitting there thinking like,
Are
but
you
you're
playing
not.
tennis?
Yeah, right. Like
You left-handed tennis player?
exactly. Like you're right-handed, you're right hand dominant. How is it possible that your left hand or your left elbow is bothering you? And the research says that on that left arm or on that lead arm that you can get some tennis elbow as well with the repetitive motions of the swing. And so I think a very important thing to kind of think of as well is just, and you don't have to go crazy as a clinician, like trying to look at every single specific thing, because then we're going to get a little bit of paralysis by analysis, so to speak, right? And be overthinking the case that's in front of us. But I think it's important to at least understand or have a general knowledge as far as the musculature that's involved throughout the different phases of the golf swing, because it kind of helps as far as knowing certain things you should be looking at and you can kind of use to help guide your treatment. Like, for example, during the backswing of again, a right-handed golfer, during the backswing, the upper and middle trapezius are the most active muscles. And this is from an EMG study. And so if you think about that, that makes sense because as I'm going into my backswing, I'm getting what? Scapular elevation, right? Scapular upward rotation. So it would make sense that my upper and middle trap are going to be the most active muscles. That's important because that can help you with being able to understand what's moving when and where, as opposed to on my left side, as I'm coming through, the most active is my infraspinatus, right? So we're seeing a little bit more of like the rotator cuff side on the opposite side arm, which if you think about it and you think about the rotation that's happening between the internal external rotation, it makes sense as to why those muscles are more prevalent through, the different phases of the golf swing. But
That's awesome.
I actually have a question for you, Brent,
Yeah.
because I think that a lot of people like they want to work with golfers or they see golfers in the clinic and golf is and I don't mean to offend anybody that's on here. This is what I get from the general public, but golf is not a quote unquote sexy sport, right? A lot of people want to work with the basketball players and the football players and stuff like that. I think golf is a beautiful sport. But a lot of people, because they don't see the sexy in golf, aren't really privy to how they should go about, treating these golfers. And so I'm curious for you and just like your many years of experience and expertise, like what would you say are some of your favorite ways, like when you have not even just golfers, but these rotational athletes that present to the clinic that, they have pain, they need to get some rehabilitation done. Like, what are some ways that you create like an immediate or positive movement experience when they present to the clinic?
Yeah. I mean, first of all, the minute that we throw out the word rotational sports, humans, most of our activities are reciprocal. So it does expand very quickly. I saw Christine put a note down there that kayak is a rotational sport. Kayaking is a rotational sport. Fishing is a rotational sport. Swimming is a rotational sport. Tennis, paddleball, soccer is a rotational sport. So human reciprocal movement is the rotational sport. And in answer to your question, Karl, I think that, you know, we have to decide. People would come up to me all the time and say, "Oh, I want to be able to work with dancers." And my first
Hmm.
question to them is, "Why?"
Hmm.
Like, there's no money. You're going to work weekends. You're going to hate life, and it's going to be really rough. I mean, why do you want to work with dancers? And then I
Right.
them sort of pause and it's like, do I really want to work with dancers? Because it sort of seemed prestigious when you said you work with the Miami City Ballet or Sacramento Ballet, or you did some consulting for, this company or that company. And I said, yeah, I mean, it's because I love dance and it's because I
Hmm.
used to dance. And so I found affection for dance and I felt empathy and compassion for dancers that were injured and sort of the level that they were not served like other prestigious athletes, right? So we know, like you mentioned, the basketball and the football and baseball, they have people just dying to get in there to be able to be an athletic trainer or a physical therapist or Pilates teachers in these organized sports. The On the other hand, if you're looking for a sport that you really want to look at that you can continue to grow in for the rest of your life, and it has the resources and the quality of life that you might be looking for as a practitioner, wow, golf is like number one. It's number one. Tennis is number two. I'm assuming pickleball is up there giving some competition to that. But these are adults that are typically financially stable. They are mostly recreational athletes. And so you're not going to have to work with them on a weekend. You're not going to have to work in the evening with them, kind of thing. So you can have a normal work life. And then the question comes down is, do you like golf? And do you like tennis? And my thought always is when we look at that, how we go through our assessment tools, And we're looking at things like the ICF model, and we're interviewing people and asking them, what do you believe you should be participating in? Right. And that question allows us to identify their activities. And the activities sometimes could be things like golf, it could be bending down to pick up grandkids, whatever it is. And the beauty of things like tennis and golf and swimming and these recreational sports, kayaking included, is that they're usually people that are able to take care of their bodies and often desire to take care of their bodies. And it's a great audience to work with, I guess, is the thing that I'm trying to say. I don't know that you have to be in love with golf to work with golfers. You need to be in love with people that love golf to work with golfers.
Mhm.
And then the last thing that I would say on that question is I would prefer you not work with anything as a specialty unless you actually are out there practicing it and taking lessons and playing volleyball and playing tennis and learning how to swing a racket and going out there and having that experience, because your body then is going to help you become a better teacher and facilitator of the healing. It's the same thing I tell people with dance. It's like, well, when was the last time you took a ballet class? Oh, I've never danced before. Yeah, well, why do you want to work with dancers? I don't understand. And so there has to be something that makes sense for us to do it. And like I said, if you're looking for a financial, a quality of life, something that is incredibly normal in human behaviors to swing or rotate, and to be an expert of rotation has application to 80% of our activities as human beings. And we'll go into a little bit of detail on the biomechanics of that in a few minutes. But man, it's like with golf, if you can tap into the golf world and whether you're working with teenage boys and girls that are learning golf, or you're working with a high school, college team, that can be so much fun, and you can have so much positive influence on them. And when we look at injuries in golf, I didn't know that back was number one. I would have thought it was elbow and then almost reverse. It all makes sense to me, but it's interesting as what actually is manifesting. So that was some.
Yeah, most definitely. You know what's for me, it wasn't really like surprising, the back thing, and I'll tell you why. You said something a second ago that was like very key, and we've had these conversations as well, is like being able to practice what you preach, right? Or being able to like work in whatever particular niche that you have a passion for. And so for me, when I saw the statistics as far as back pain, it made sense to me, because one of the first times that I went out to play golf and I was learning how to play golf, I remember that session lasted for an hour, and that next morning my back was on fire. And I was like, why does my back bother me so much? But I didn't understand that when you're in that golf stance, before you go into backswing, before all of that stuff, you really use a lot of your back and you don't even notice. Like those deep lumbar stabilizers, multifidi, and even the paraspinals, like they are firing to keep you at a good in a good stance. And
Yeah.
so,
And there's two parts to that, Carl, because one
yeah,
is the novice is always going to over recruit. So think of
of
the first
course,
time you learn to ride a bike, the first time you learn to throw a ball. We use every muscle in our body and we're going to be sore. So
of
that's one.
course,
But you bring up a more important thing. It's like even the way you address the ball.
yeah,
Like we see a lot of people go and address the ball and they go into a little bit of a posterior tilt
yep,
and around their shoulders. And immediately what they did is they're forcing all the rotation to go through their low back, and they've eliminated the rotation in the thoracic spine. And we'll show some slides in a second. But that, right away, that jumps up in my mind of thinking of, how people bend forward to address that ball, or do we go into a little bit of extension and send the hips out? And if the sit bones are sticking out when you're sort of down in that position, now hips, the pelvis has good rotation over the hips. The lumbar, again, the lumbar doesn't have a lot of rotation, right? So, I mean, if you think of it, it's like we might get 3 to 5 degrees in the lumbar spine. So it should not be our primary mobility arm of rotation, never ever, right? We might
Yep.
get 15 degrees out of the low back safely. But when we look at the thoracic spine has a different orientation in its facets that allow with 12 vertebral segments and the disc. It's like even if you get 3 or 4 of those segments to move, and that's where that promise comes from, Karl, is like if we can get 3 or 4 more segments to be involved in the thoracic spine with their orientation to gravity, all of a sudden you've increased their rotation by 15 degrees, right? It's like 5 degrees per segment, something
Yep.
like that. So that's all of a sudden they got 15 more degrees. Well, 15 degrees can equal 20 yards. I mean,
Hmm.
it's really simple math. You can't promise them where they're going to hit the ball, right? I never make a
Yeah.
promise. Um,
Yeah.
but the idea is just simply getting them to relax and start knowing where the movement actually is coming from immediately relieves them of potential risk of doing harm to their back. So, when you see them go through the follow through swing and
Hmm.
they have that poor address posture and they go through, it's like you can just see like just crunch in that low back at the end of their swing in that left side bending and extension closing down that low back. And it's quite painful to watch if you are familiar with spine mechanics, right? Versus watching somebody very experienced, like Singh is a very famous golfer, and his rotation, he can rotate almost 180
Right.
degrees around, and it's all coming from him developing good thoracic mobility and hip mobility. So it's
Yeah.
like beautiful the distribution. We talk about that. The distribution of movement equals distribution of force.
Yeah. Yeah. And I would say even on the flip side of that too, like just another important principle is you think about like Wolff's Law, right? And you think about the fact that with Wolff's Law, it's important to be able to have the bone tissues adapting to the stresses applied to them. And so, like what you were saying before, yeah, for a novice doing a new task, your body hasn't been able to adapt. The tissue has no adaptations there yet because it's new. But the more you're able to introduce those movement patterns and the more you're able to kind of create like that neuromuscular connection, the better you'll get and the more of the improvement you'll see. And I'll say even too, like it's not about like, yes, we can give that guarantee or we can give that notice that, hey, we can get you an extra 20 yards on your drive. Like you said, we don't know, we can't tell you where the ball is going to go. That's not my job,
That's
right?
the
That's
golf.
that's
That's
the
the
job
golf
of a
pro.
coach.
Yeah.
Correct. That's the job of your golf coach. But what I can do is help you be able to get that more mobility in your thoracic spine. And then it's up to your golf coach to be able to work with you to make sure that that newfound mobility that you have you can use it efficiently with your swing. So
Yeah.
yeah,
Yeah.
that was I love what you said just there.
So there's a question on the table from Linda Benton on just getting clarification on Wolff's Law. And Wolff's Law is a biomechanical law. It says that the body adapts to the stresses that are applied to it. So, for example, we see bone spurs or we see scar tissue or we see bone density issues, those kind of things. It's usually related to the stresses that are applied to it. So we know that the tissue adaptation model, it's very important for us to always be thinking of somebody who, let's say, was in really good shape, right? They get hurt and now they're rehabilitating with us. Well, their tissues were already in prime condition before they got hurt. And so the recovery is going to be much faster. And we don't have to be as sensitive to the tissue adaptation laws and rules. Where somebody who was very deconditioned or had been hurt for a long time and now is coming back, their tissues have become weak or they have become the body's always trying to be efficient. So if you're not using that part of your body, it's going to put the energy somewhere else, right? And so Wolff's Law basically says that tissues adapt based on where the stresses are applied. And so if we practice something faulty, the tissues adapt faulty. If we practice something with good alignment and good organizations, the tissue will adapt according to that organization. And that's where Wolff's Law comes from. I want to jump into something here. When we look at the vertebra themselves, and you've heard us, anybody that's been around me for a while has heard of things like the facet dance. And of course, I got that from Eric Franklin 25 years ago. I love the image of it. But if we look at the lumbar spine, I showed you the lumbar spine, that if you just hold your hands up like this with me, right? So it's like you hold your hands up so that they're vertical and sagittal. This is what a lumbar facet is like in the back. And that facet really is ideal for weight bearing, a little bit of flexion extension, and some side bending, but very little rotation. It might get 3 degrees, 5 degrees per segment. That's not a whole lot, right? But as soon as we come up into thoracic, change the orientation of your hand so palms are down, and it's about what we'd call 65 degrees. And now in an upright posture, that motion, that unilateral motion, is going to be a lot of rotation. And so we can get a good 5 to 6 degrees of rotation per segment. And I was corrected on a study that I presented a while ago, that there is actually more lateral flexion than we thought also in the thoracic spine, which actually makes sense based on the angulation of it. So we talk about rotation, but that also is a side bending component to it. So that thoracic mobility becomes incredibly important to the golf swing. And the last thing I'll bring up from that biomechanically is here's a little miniature shoulder blade, right? And if we're looking at the number 2 and number 3 related injuries being in the upper extremity, we're looking at really the force not transferring correctly through the scapula. So we could go in and say, I'm going to do a lot of transverse tissue massage on that rotator cuff. I'm going to do some deep tissue work on the wrist extensors and that lateral and medial epicondyle, depending on what's affected by it. But again, I believe this is a Brentism. This is a Brentism. I believe, anybody that wants to do a fact check, we can do this. But to me, it's more the concept of distribution of movement is distribution of force. So if you all maybe you take your cell phone or something and we pretend that it is the scapula, right? And scapula is made to go up and down, so elevation, depression. The scapula is made to go forward and back as protraction and retraction. It can go in an upward rotation and a downward rotation. But what it doesn't have is it doesn't have extension and it doesn't have rotation. So if I bring that little tiny scapula back up and I'm saying that here's on the right scapula, it doesn't have extension and it doesn't have rotation. And yet when I pull my arm up to swing a tennis racket, or I'm in my back swing, force swing with a tennis racket, that shoulder blade has to go into extension and rotation. And the only place that can occur is the synergy between the thorax, the ribs, and the shoulder blade. And so if that doesn't occur, then we have unwanted stresses going through the shoulder itself, the glenohumeral joint, and the tissues around it, as well as through the arm and the forearm and the wrist. And I that's my feeling, is why I believe that in the Pilates, where we start introducing distribution of movement concepts, and we're increasing the mobility in the foot and ankle, we're increasing the mobility even in the knee and the fibula, we're increasing mobility in the hip and the pelvis and the lumbar spine, the thoracic spine, the shoulder girdle. That motor control of that distribution of movement is what makes a golfer great. I'll repeat that. The motor control of the distribution of motion or movement throughout the entire human body in that reciprocal motion is what increases the performance and the power and the speed of that club and minimizes the risk of tissue damage into any part of the body, whether it's low back, shoulder, forearm, ankles, knees. I've seen all of those as being complaints of a golfer and a tennis player. And yet we have that solution right in front of us, don't we, in the Pilates arena. There's a question here. Let's answer this question. I'll turn it over to you. Yasmin Regalado says, most clients taking golf as new hobby are often clients who come in are coming off of retirement, right? So again, looking at an age-related concern here as well, which Yasmin's right on the money here. What area
Mhm.
would you focus for strengthening first to help the client or patient to develop the best foundation to start with? And
Yeah,
I think about it. I want you to share like what would you think, and then I'll share a little bit about what I think. So you got
yeah. This
somebody
this
like
is
my age that wants to golf.
This is great. No, this is I love that question. And I think this is a great one for us to be able to piggyback off of. So the first thing that I would say to you is there is no, and I'm sorry, this is just me being honest. There is no necessarily specific area that I would focus on right out the gate. I think it's more so being able to understand, and we talk about this, right? The ICF model, participation, right? Quality of life, things that the individual wants to be able to still do. They're going into retirement. What are some other things that they want to still have a certain level of function with, or they want to be able to do in their day-to-day? Grandkids, picking them up, anything like that. And the next thing that I would say is once you're able to kind of talk to them and see like from a bigger picture everything that they're wanting to do and the activities that they would like to do, but they think they have restrictions, uncovering through your interview a little bit more why they think it is that they have those restrictions. A lot of times, you don't have to seek out what is going on with a client. They will tell you. If you listen and you ask the right questions, they will tell you. But I will also say to you, on the flip side, a really good place to look at when it comes to senior adults that are playing golf are the hip internal and external rotators. And that comes from research and also just think about the fact that once you start getting more into like that 60, 65-ish prime time type of age, you start seeing a lot more higher incidences of what? Arthritis, osteoarthritis. And I think a lot of times there's this misconception, right? And part of it is our fault as clinicians because we don't do a good job of being able to fully educate people and helping them understand like just because you have arthritis, just because you have osteoarthritis does not mean your life is over. And a lot of times these doctors show them, the MDs will show them the X-ray and you have like no space between your joints, so your cartilage is worn down, right? And they're kind of using these words that are instilling like fear and just giving like a negative connotation to these people. So by the time they come in, they're already thinking they're doomed. But what I will say is knowing that osteoarthritis is something that you see a lot in that population, and the hips being one of the joints that are affected a lot, I would take a look and see what their hip internal and external rotation looks like. It was like hip joint torques during the golf swing of young and senior healthy males. And what they found was that one of the differences was that there was decreased trail limb hip external rotation torque. There was decreased strength and muscle mass related to the potential decreased torque as well at the hip external rotators. And it found that if you also focused on strengthening the hip extensors on that trail limb, that could be beneficial. And so a good place for you to start, I would say, would definitely be the hip. And just think about that. I don't have a model in front of me. I don't know, Brent, if you have like a hip model, but if you think about just, you do, perfect. Think about when you're going back into a backswing, the rotation that's happening between backswing and then coming back through acceleration, right? The internal and external rotation that's happening between the lead leg and the trail leg. those are good areas to look at. And if you're a physio and you love the objective measurements, you can sure pop out your goni and look to see, if they're within normal range of hip internal, external rotation. But hip external rotation, internal rotation, hip extensors. The hip in general is a great area to start. I just say don't have tunnel vision and think about the person you have in front of you and see if there's anything else that may need more emphasis before you just go to the hips.
I think that's great advice. I think that, um, one of the things that I work with some of the older golfers that I work with, one was even in her 90s, very avid golfer, is looking at what they don't have and
Mhm.
then identifying what they do have, and then modifying the technique within that range, and also even things like the clubs. So going from steel club to graphite clubs, and going from a full swing to a half swing, and even playing a shorter game, so that she could continue enjoying golf in her 90s versus being frustrated that she couldn't golf at all. And so, when you start looking at things like, an old knee fracture of the fibula and the tibial plateau, and you look at a couple fusions in the low back and things like that, and now you're looking at saying like, okay, maybe I only have about 75% of the range of motion in the hips. I need to use thoracic, but we're also dealing with just normal aging, degeneration in these joints. How can I teach her a safe range to golf in so that she's not aggravating things, right? And what I also want people to understand is that tissues still adapt even in our aging years. So we can create better bone density. We can increase capsular range of motion. We can actually restore some of the resilience in the cartilage and the synovial quality with movement. And that's why, Carl's dead on when he talks about this idea of the inappropriate catastrophizing through fear of degeneration. And really, it's like we look at our skin and we go, oh, yeah, I got wrinkles on my skin. I must be getting a little bit older. But it's, in and of itself, it's not a pathology. And degeneration in joint space is also a very normal aging process. And many of the studies, the research out there shows that there are, people that don't have back pain, never had back pain, and have incredible degeneration changes bone to bone and never have had symptoms. And so we have to be very careful of limiting people's functional activity because of some diagnosis that came from one of us in the medical community. And so, when one of the beauties for us, both in the combination of using the Polestar assessment tool as well as just the Pilates environment and the philosophy of looking at whole body, right? Like you said, Karl, looking at the whole body, looking at, when we talk about rotational activities and rotational sports, we're looking at, you know, feet, toes, ankles, spiral, torsion, tibial torsion, international rotation of the hip, the pelvis movement, and sort of spring loaded. And what I want to finish up with is looking at the idea of how the connective tissue around everything and through everything and in the bone and in the organs also is responsible for these rotational sports, right? This is where our power comes from. You don't want to think of power coming from the arm for swinging a golf club, right? It comes from that whole connective momentum of rotation coming through the whole body. And when we can think of that, we start talking about, again, the biotensegrity model of the idea of this fascia and connective tissue that's very elastic in the myofascial tissue, that we're dealing with a balance of compression and tension. So the other thing that I look at with golfers that are coming in or people that want to be golfers is how much compression do they have in the front of their body and tension in the back, and how can I equalize that? So in response to your question, it's like, can I start working with a little bit more emphasis on extension and opening up the front and starting to load those tissues in all directions and rotation so that we start building that elasticity and elastic adaptation to those tissues to play a rotational sport. Because if we don't do that, then we're just structures moving through space with a lot of force, but no motor learning, no myofascial adaptation, and we start having injuries, right? So I would say number one, let's identify what range of motion they do have, and let's start playing with tissue adaptation inside of that range of motion and balancing that front and back. So I'm thinking of like, oh, I'm going to strengthen the rotator cuff, or I'm going to strengthen the core muscles, or I'm going to strengthen the hip muscles. Start learning and watching the balance of it. Very much in alignment with what Karl mentioned is we are usually very weak in our hip abductors, external rotators, and adductors, probably because of our sedentarism. And if we can sort of focus on that in our Pilates training to start having mobility and control of those hips, that can really increase the endurance of rotational sport athletes significantly. Because the minute that they stop working through the hip, they tuck the pelvis under, the movement's going to go through the low back, the knees, and the toes. That's where we're going to see the injuries down below. And then that means the force to swing the club has to be that much greater in the upper extremity, which is really not where the force of that club should come from. So a couple thoughts there. We have another question that's up. Elena says, thank you so very much for a great talk. My question is, do you recommend to do a rotation by all of our body in comparison to movement by a single body segment, for example, rotating just the shoulder? And I think I just answered that. The key is we're a whole body. And if you think of the myofascial system as the force, but here, you sort of see the complexity of, and this sort of shows a little bit of hand drawing of the fascial slings, but also just understanding this, how we use our opposite side for movement. There was a study I was looking at, Karl, that was saying that for movements that are larger in dimension or power, we have to have the opposite reach or pull to be able to create that as human beings. So here you see she's getting ready to kick with the right leg. And what is that left arm creating, right? She's creating that tension across the front of the body that is going to allow that tension, that elasticity to increase. So when her foot comes in contact with the ball due to her practice and her competencies, that's where the power is. And it'd be the same thing with the golf head hitting the ball, right? It's like you sort of feel that opposite force as the club comes back, that opposite shoulder has to come forward. That's that opposition of force. And as the club comes down, it's going the opposite direction and it follows through and coming back off the other side. So, these are very complex functions, but yet they're incredibly natural to human beings. And so a lot of times it's just restoring a lot of these natural products. This is a comment in the chat from Raymond. It says, a former student of Dr. Anderson and fellow classmate of Dr. Karl, just want to say I love what you guys are doing. Keep up the great work. Thank you, Raymond.
Appreciate you, Ray.
Yeah, cool. Good to see some of our colleagues jumping on here now. Karl, any last questions for me or that you want to share as we sort of wind down these last 3-4 minutes? It's hard to believe we went by that fast already.
Yeah, I know. Something that I'd love to kind of leave with people and understand all of the information that we just said. Golf is the imagery that I used because that is where I specialize. But these principles apply to rotational sports in general. I think when it comes to being able to understand as well just how you can be of influence, I like to think of 3 buckets when it comes to form. It can be for golfers, it can be for tennis players, it can be for volleyball players, it can be for kayakers, whatever rotational sport. But I like to think of 3 buckets to help me understand what I may be dealing with. Number 1 is a mechanical problem. And so if there's a mechanical problem, that lets me know then maybe there is something from a standpoint of the biomechanics that need to be worked on or need to be fixed. If that's fine, I move on. I say, okay, it's not mechanical, then it may be equipment, right? Maybe I need to switch out the club that I have because the 5 iron doesn't work for me as well as a 6 iron works for me, right? So equipment is another thing that can play a factor. And then if it's not mechanical and it's not equipment, the third thing that I would say is more of like an anatomical impairment that may be something that is more so they have whatever restrictions that need to be worked through. And it's not necessarily just the mechanics of how they're moving, but it's some tissue or something going on from an anatomical level that's stopping them from being able to be efficient with their form for their tennis serve or their form for kayaking or whatever the case may be. And that has been a pretty good locus of being able to help drive where I focus and where I put emphasis. So hopefully for someone, that's like, this is a lot of information, just kind of categorizing things in those three buckets helps to simplify it and makes it better for you to be helpful. So those are the only things that I would say in parting. And then I guess, Brent, like a final question for you, which I think would be good for people is, in the book, one of the principles that you talked about, is the principle of breath, right? And I loved the illustration that, you made between just how important breath was and how we talk about like if you're someone that has a biblical background or, some kind of religious background, in the Bible, how it talks about, God breathing life, right? And so there's this idea that breath is essential and important. And so I guess I just would ask you, because I think it would be good for the audience as well, is just how you think breath influences the performance side as far as these different rotational sports.
Good timing because Catherine Connor just threw up a question there too, asking the same thing of like the
Oh,
principle.
boom, boom.
Yeah, like, is Carl reading my questions?
No, I didn't, Catherine, but I got you covered.
But it's like it's absolutely Catherine's right. It's like breath facilitates movement, movement facilitates breath. Um, wow, especially when we're looking at things like organization of head, neck, shoulders, thoracic, breath is such a powerful tool for us. And one of the things I do quite often, Carl, and you experienced this when you were in school, and I taught just the Pilates class your very last term. And so many of the students are like, I never really had that much centered focus on breathing as part of the movement. Because when I teach movement, I don't teach muscle contraction or volitional muscle contraction. I teach movement through space, breath facilitated movement, external imagery to facilitate that movement. But I really never use squeeze, pull, hold, those kind of cueing of muscles, no volitional cueing. And one of the things I love is that, breath, we can breathe in multiple dimensions in our body. So we have superior, inferior breath, we have anterior, posterior, and then we have lateral or circumferential breath. And so we have that ability to do that. Most of us have a dominant direction or pattern. If you don't have it in all directions, does not make you a bad breather because you're still very much alive. Your skin looks good. Your oxygenation count looks good. But what we find is that if we can create a more successful capacity to breathe in multiple directions, what we've also done is increase thoracic mobility, rib mobility, shoulder girdle mobility, all of which can be used in facilitating a more efficient rotational sport activity, right? So whether it is kicking a soccer ball, swinging a golf club, playing volleyball, swimming, and of course, golf, all of those would benefit from what breath does for us. Now, the other thing that I would mention is when we go into positions, like let's say we're doing our mermaid with a rotation and we're going into flexion or we're going up into an extension, like use the breath as the tool to drive that motion, like find new motion in your body. One of the things I love doing with the golfers, especially, is in the mermaid position, and they don't have to cross their legs into Z-sit position. They could just be sitting on a chair and bring their hands here, and they can be working on going through flexion, extension, or rotation, because this is exactly the motion that they're going to have going through their body when they're coming through that preparation for a swing and the follow through of a swing. So if we can use breath to start increasing that mobility in the rotation, in the direction of where we want those ribs to go, we really understand that. That can be a massive beneficial tool in restoring that biomechanical restriction that they might have, or that neuromuscular restriction they might have in that upper rib cage, especially. And you got to think, if the sternum can rotate, right, with the ribs around, the shoulder girdle is also rotating and doing that, what I said, it doesn't do naturally by itself. It has to be paired with the thoracic cage and the rib cage. It has to be paired. Well, Karl, our time is up and it has run fast. It's been very fun. I would love to hear from the audience, just whether you send us messages later or not, or you do so now in the chat. I'm playing with some new formats. I wanted to bring Karl on today and just sort of test the idea of him asking me questions and vice versa about different topics and things that we might do with some other practitioners as well, and looking at more from a learning forum and a discussion forum and bringing your expertise as well. And so we'd love to hear from you if you felt that this was beneficial to you. We're always looking to improve the Pilates Hour and bring you some diverse tools that can help you in your practices. So we hope that that is good for you. I also wanted to break Karl in on the Polestar chat, because I'm gonna be inviting him a lot to different things, and I think he's just wonderful, and he has a great air about him and ability to just share his passion for movement and his passion for learning and rehabilitation. So thank you, Karl, for being with me today.
Yeah.
A lot of fun things. Quick announcement. You'll be receiving, as Pilates Hour followers, you'll be receiving the most recent announcement coming out this week or next week that is going to be the Pilates Hour workshops. So many of the guests that you have rated the highest, we have contracted to do a 3-hour workshop, one a month, for literally the next 12 or 10 months. I think we start in February or March. But keep your eyes open for it. There is a very special discount for you. We keep the price really low. You're going to have some one-on-one time, basically, with these experts from Elizabeth Larkham and many of our guests that we've brought on that are phenomenal, and will continue to bring you greater knowledge and practice to your profession. And lastly, just want to wish everybody a very Merry Christmas, Happy Holiday, and Happy New Year. And above all things, we desire to bring the world physical, emotional, and spiritual alignment. And we can start by just being kind to everybody around us. Thank you so much for joining me. You're the most important part of the Pilates Hour, and we appreciate your participation. We love you and hope to see you in the beginning of the year. Happy holidays, everybody. Thank you, Karl.
Thank you. Happy holidays, guys.